Hello, I am Ulcer, the specialist, your host and regular anchor on this program, Kunia Health, and I have come here today to discuss stomach ulcer. One particular problem that a lot of people are really angling to know how to treat, and they have asked questions whether this particular condition can be cured. And here I tell you, yes. And also urge you not to be trying everything just because you're having pain in your stomach. Stomach ulcer or peptic ulcer is very treatable, and the treatment has lasted for over 30 years. Very efficient. But you need to understand, how does this happen, what causes it, and how is it treated? Stomach ulcer is not just a pain in your stomach that you go around always taking a lot of things because you have pain in your stomach. Could be very deleterious to your health, that you are trying to treat something else that is giving you a different symptom, thinking it is stomach ulcer. No. And the whole gastrointestinal area is very delicate. I mean, your abdomen, your stomach, intestine areas, that you do not have to take anything without diagnosing. You need to go to lab. You need to see your doctor so that proper diagnosis will be made to find out what actually is wrong before you begin any medication. The medicine you are taking might be the medicine that will cause you worse situation. It could be your gallbladder that is emerging in its pain. It could be something around your liver, even though your liver does not have pain receptors. When there is a worsening condition due to certain things that your activities or food, at some times of its degradation, from fatty liver to fibrosis to cirrhosis, you begin to feel it. It could as well be your kidney and radiating pain come up there. Yes, it could as well be any other thing around the diaphragm. So be careful in taking medicine when you have not been properly diagnosed. A lot of people have tried to diagnose themselves and mention that they are suffering from ulcer when it is not ulcer at the end of the day. Sometimes it might even be worse, or it might just be diverticulitis or diverticulosis or something. It might be UC, ulcerative colitis, or cancer. However it is best to know what it is before you know. So simply, ulcer. In explaining ulcer, I want to show you the human digestive system, which you see the picture on the screen. Ulcer is simply the injury caused by certain factors on your stomach wall or on your intestine that has caused you the acid in your stomach or the gas to be elevated, such that what we call the pH will become decreased because of the increased acid, and the stomach will suffer from a lot of irritations. And the second factor is in the injury, it develops sore due to a certain kind of infection caused by a bacteria known as Helicobacter bacteria, H. pylori, which invades and finds a harbor and inhabits in your stomach area. This particular bacteria, I will need to explain it more. Helicobacter bacteria is a bacteria that survives in alkaline environments. However, the stomach environment is very acidic, such that the pH value is between 1.5 to 3.5. But this particular bacteria survives because it has a strategy of releasing an enzyme that helps in terms of diluting this acid and makes it more habitable for it. This bacteria can be found on your skin because it is in the environment you are. It might just be there, or in dirty water, or you may not even see dirty water, or in just your atmosphere somewhere around you. But when it finds somehow to enter your stomach, that is where it begins. But it is worse when there is already an existing irritation, which could have been caused by perhaps stress, perhaps the food you eat. What kind of food? We're talking about food that will be very spicy, that will cause you gastritis. And what is gastritis? Irritations that have been increased due to inflammations on the walls of your stomach. So this wall of your stomach we're talking about is very soft. We call it the mucosal wall. And your stomach wall and inner walls has a lot of proteins, different names. So when the degradation of these proteins of this wall now will be due to the irritations that has been caused, maybe you have taken a kind of what is called NSAIDs, drugs that exacerbate this. NSAID has a way of causing inflammations in your stomach, in as much as they are non-steroidal anti-inflammatory. They cause it because if you take them for a long time, they begin to cause you bleeding. And the other ways of its causing as well, because of the pathway through which its healing comes, because it has to really go through a path known as attacking or inhibiting what is called the cyclooxygenase, either the cyclooxygenase 1 or the cyclooxygenase 2, COX1 or COX2, depending on the kind of NSAID you're taking. NSAID 2 commonly, which has to do with the ibuprofen, the naproxen, and a whole lot of them, the ketorolac, will be the one that's talking about the COX2. And in this particular one, they impinge on what is known as the prostaglandin that causes inflammation. However, they also affect the bleeding. Yes, clotting. They affect the clotting level and they make the blood to be very thin and bleed. And that is where it now comes. Now, that is a different pathology. On this ulcer, what happens on this ulcer is that when these walls of your stomach have been exacerbated by you taking NSAIDs, by you having certain stress due to you have not eaten for a long time, or because of overthinking, which now invites cortisol, the stress hormone, to begin to act, and this causes a lot of injuries on the walls of your stomach. What happens now is that this bacteria finds a way and hides itself on the parietal wall, parietal cell of your stomach, where it now begins to perforate and cause injuries. While it hides and still vomits, or rather releases its enzyme known as urease, U-R-E-A-S. And this is what now covers it while it performs its work of endangering your health. In the cause of these perforations, it affects the area known as the proton pump. The proton pump, which releases the gas or the acid, the hydrochloric acid, which pours into the stomach. As this acid releases and pours into the stomach, the level of the acidity elevates, while the bacteria finds comfort, because the acid is not affecting it because of the urine. Now, what happens more is that the irritation continues, the gas now continues, and you begin to feel discomfort. The increase in the gas causes more exacerbation of the injury already caused. And now we're talking about the treatment. But before this treatment, the symptoms of pains, heartburn continues. And you ask me, why is it connected to heartburn? Because as the heart, as the stomach level of acid as the level of acid in the stomach elevates, it finds a way through the esophageal sphincter to leave and go through the esophagus, burning the pipe always, and causing irritations on the walls of your chest area in the pipe. And within that pipe, you begin to feel the pain and the symptoms that follows. The continuous refluxing of this gas into your esophagus would cause more problem. And if you leave that, it will now go to problem known as GERD, gastroesophageal reflux disease. It's a different topic. So, on this topic, treating the peptic or stomach ulcer will now be focused on killing this bacteria as well as stopping the gas from flowing. And how do you kill this bacteria? Antibiotics anytime there is a bacteria. But am I telling you this to start taking it? No, because the test must be done to confirm that you have H. pylori before you use antibiotics. Otherwise, you'll be causing yourself more problem. Yes. If you take antibiotics like that, you cause yourself more problem. And there are standard drugs for this. As much as so many antibiotics may try, you don't use one antibiotics for this particular drug. And there are specific dosage for them so that you'll be able to kill this bacteria. The dosage will only be known if you have the problem and want a personal discussion. We don't throw it out here because people will begin to self-medicate. But I'm making this video for those who are in areas where it is difficult for them to find a doctor or hospital, at least where they are allowed to buy their medicines. But before then, there should be special consultation. Let me let you know without charge, so that you will be able to know that you have done the test and be able to know your age and whatever you are suffering, so that you do not have interactions with the medicine. when you are taking your other medicines of the condition you have. Because you could be having high blood pressure, you could be having other diseases that will not want a certain medication amongst this. Be careful, because your health is our concern, and health is wealth. Besides that antibiotics that will have to kill this bacteria, we're talking about another thing that will have to lock up the pump, and that is proton pump inhibitors. Do not go for H2, which is the H2 inhibitors talking about histamine. No, they are not the best. Proton pump inhibitors have been used for over 30 years and has proven to be very efficacious. And that is where you'll find the categories of omeprazole, pantoprazole, lansoprazole, and the rest of them. So, with that, with a certain particular dose that will be used, then your stomach ulcer will have to be treated. But you have to treat them accordingly, because those proton pump inhibitors must be taken at least 30 minutes before you eat your food. If not, then you may be taking this drug for years, and you keep complaining of stomach acid and ulcer. But at that time, it may not still be ulcer. It might go to the extent of causing you bleeding and consequently ulcer, cancer. So be careful. Then, what do? When you wake up in the morning and want to take this drug, what you will do first is to ensure that you take the proton pump inhibitor at least 30 minutes. Take it 1 hour, but at least 30 minutes before you eat your food. That is when it becomes able to be absorbed and do its job. Then when you eat your food, you can go on with your antibiotics. Clarithromycin and amoxicillin have been proven to be efficacious, but the dosage I say, hold on. This is Kunye, and I will see you next time. Thank you, and have a wonderful day.